In recent years, a crisis has been quietly unfolding across healthcare systems worldwide: health worker shortages. From hospitals to primary care clinics, the demand for qualified professionals continues to rise, but the supply is struggling to keep up. This shortage isn't just a number on a chart. It's a real, pressing issue that affects patient care, mental health of healthcare workers, and the overall effectiveness of our health systems. As the population grows and ages, the need for doctors, nurses, and support staff increases. But burnout, limited funding, and a lack of resources are pushing healthcare workers to their breaking point. In this video, we'll dive into the causes of this crisis, its impact on communities, and explore potential solutions to ensure that everyone has access to the care they deserve. Join us as we uncover the reality of health worker shortages and what needs to be done to address this growing concern. As I mentioned, in recent years, healthcare systems around the world have been facing an alarming challenge: the growing shortage of health workers. From doctors and nurses to lab technicians and mental health professionals, the shortage is widening, and the consequences are far-reaching. Across many countries, healthcare providers are overwhelmed, with hospitals struggling to keep up with demand. The COVID-19 pandemic only exacerbated the situation, stretching already limited resources to their breaking point. But even as the pandemic recedes, the shortage persists. In the United States, the American Medical Association, AMA, estimates a shortage of up to 124,000 doctors by 2034. Nurses are also in high demand, with the U.S. alone needing nearly 1.1 million additional registered nurses over the next few years. The situation is similar across Europe, Canada, and many developing nations. So, why is this happening? Several factors contribute to this healthcare crisis. First, there's the aging population. As life expectancy rises, the number of people needing medical care increases, creating a growing demand for healthcare professionals. In many countries, the aging population is outpacing the number of new healthcare workers entering the field. Another issue is the lack of medical education infrastructure. Training the next generation of doctors, nurses, and specialists requires time, funding, and resources. With rising tuition costs and the physical and emotional demands of medical professions, fewer young people are choosing healthcare careers. Workplace burnout is also a major factor. Healthcare workers, especially during the pandemic, have faced high stress, long hours, and emotional exhaustion. Many have left the profession or retired earlier than planned. Those remaining are struggling to keep up with the growing number of patients. But there's hope. Technology is stepping in to help bridge the gap. Telemedicine, AI-assisted diagnostics, and automated tools are beginning to lighten the load for healthcare professionals. In fact, studies show that technology can help reduce administrative burdens and give providers more time for patient care. However, technology can only do so much. We still need people, trained professionals on the front lines. Addressing this shortage requires systemic change. That means better support for medical training, increased funding for healthcare institutions, and, most importantly, more respect and recognition for the incredible work healthcare workers do every day. As we look to the future, it's clear that addressing health worker shortages is crucial to ensuring that everyone receives the care they deserve. It's not just about adding numbers. It's about creating a healthcare system that's sustainable, supportive, and compassionate for both workers and patients. Support our healthcare heroes. Together, we can create a healthier future, one where the healthcare workforce is not only sufficient but thriving. If you found this video valuable, don't forget to like, share, and subscribe for more insights into the challenges and solutions in healthcare. See you in the next video.